Dr. Priya, I know that, a lot of you doctors got together and put together a tip sheet for us to follow and, just to help out people who may be at home and trying to treat a moderate illness. And you've also spoken very strongly about Remdesivir and said there shouldn't be this desperate rush for it like we're seeing here in India, black market as well. But at the same time, many of you doctors admit that Remdesivir does bring down hospitalization. So you can imagine how this holds out some hope for those people who are desperate.
Yeah, so I think that as the medical community, we need to band together and say that Remdesivir is useless in the present situation in India. So we can tell the public that about trial data. The trial data is, scientific analysis of studies. And this trial data showed that in the hospital setting, and remember these studies were done in the UK and the US, in these very, very stable settings, resource-rich areas, the duration of hospitalization was reduced by a few days. Now, this again is in settings where everybody with COVID is getting admitted simply because we have the beds, we're not overwhelmed. Right now, when beds are overwhelmed, when a patient who's gasping for breath is not able to get a bed, putting a patient in the hospital to give them 5 days of Remdesivir IV for some small potential benefit is criminal, because really by doing that, you're taking that bed away from other patients who could be helped by being there, getting oxygen, getting other life-saving medications. So I think we did a disservice by saying it doesn't really help, but going by the trial data, it does this, because when your loved one is in the hospital, if your mother was in the hospital, you're going to glom on to the fact that, well, it may help a little bit. And you want, it's human nature. You want to do everything possible to help your loved one. So we need to stop saying there may be slight benefit. We just need to say, under the present circumstances, do not give Remdesivir.
And the other, issue here is about plasma therapy. And this again, it's been said that it does not help. It's been proven. There have been, scientific studies as well. But even so, here in India, we see these desperate appeals for plasma.
Plasma does not work. Plasma is useless. Do not donate plasma. Do not try to arrange for plasma. It's a waste of time and money. And again, it's stressing the medical system. Obtaining plasma, doing the testing on the plasma, and administering plasma, which is completely useless, is taking away time and effort that should be devoted to patient care. So I can't emphasize that enough. Completely useless. And I can say that very confidently because the plasma trial started at Mayoclinic. A good friend of mine led the first trial. We've analyzed it and everyone sliced and diced it and tried to find some benefit from it. It was when we didn't know enough about COVID and we were desperate for any kind of treatment. We also latched our hopes onto it, but it has just not panned out. And if you can get the word out about that, that would be fantastic.
All right, a lot of energy is spent on getting plasma. Now, one of the recommendations that I've seen that has changed from the first wave, and that's when I had COVID, to this particular wave, is all you doctors are recommending budesonide inhalers or nebulizers when you get COVID. If you could tell us about this.
So it's like Remdesivir in that it has a mild benefit. If you use it in early COVID, it helps reduce the cough. So patients again feel better and are less worried about progression. It also does maybe reduce the risk of progressing to need hospital stay. The budesonide is inexpensive. It can be done at home. You don't need a hospital bed. The data is very limited. So the study that showed that it worked was called the Principal trial, and they had 2,000 patients in each arm. And the patients who got the budesonide were less likely to go to the hospital. It was reduced by 2%. So the reason we put it in the recommendation is that it's cheap. Secondly, you can do it at home. And thirdly, because the number of cases is so huge, when you have 300, 400,000 cases per day, that 2% reduction is still huge numbers. And if we can keep 2% of 400,000 out of the hospital, that is a benefit. But again, it's not a life-saving drug. Of course, when you put something out in a recommendation, it's sold out by people hoarding it. So it's really not available. And the message I want to give is if you have it, use it. If you can't find it, do not worry too much about not having it.